Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today is a special day. We have our lovely 61 years young, believe it or not, I don't believe it, patient, old patient, friend, neighbor, right? Who came to us for a few procedures.
Yes.
And we're going to get a candid testimonial from Nikki about her experience. So don't hold back.
I
Good,
won't
the
hold
bad,
back.
perfect.
The good, the bad,
The
the
good, the bad, and
ugly.
the ugly. That's right.
Okay.
All right.
You've got it.
So we're going to start. First of all, what procedures did you have done? We'll get that out of the way.
I came because I was about to turn 60. And every time I looked in the mirror, I would do this and say, I need a little something, something. And then my birthday was coming up, and my wonderful husband said, you know what? Happy birthday. Go for it. Do what you want to do.
Yeah.
So we ended up, after my consult, we decided on a lower face and neck lift.
That's right.
I did a CO2
Yep.
laser resurfacing
Yep.
and a fat graft.
Yep. Exactly. So a few procedures, which is obviously more the rule than the exception. When we're doing a facelift, there's typically 1, 2, 3, maybe 6 other concerns. And so our patients obviously want to combine the procedures so that there's one downtime with the healing.
Exactly.
So,
exactly.
okay, so we knew each other prior to the consultation, so that obviously changes the dynamic a little bit. But how would you describe coming into the consult versus leaving the consult in terms of how you were feeling about things?
I just knew that I wanted to. I'm fighting this aging thing tooth and nail, and I needed a little bit of help doing that. And of course, knowing you, having spoken with you, not in a professional
Right.
sense, it was going to be just my first, let's see what's out there
Yep.
kind of thing. And I was, I was, I had some very clear expectations, and you had the vision. And after taking a gazillion photos and looking at those gazillion photos, I was a little bit surprised at really how conservative you were. And that was a good thing to me. I felt, okay, I have an issue with this.
Yeah.
And I thought that I was going to be doing more than what you had recommended.
Right.
But I think I booked that day.
Uh-huh.
I didn't even see another surgeon. I
Right.
felt very, very confident and just really good about everything that you said and the procedures that we'd both agreed on.
Yeah, yeah, and I think that's an important point, which is that obviously being a good fit for each other, right? A physician being a good fit for the patient, patient being a good fit for the physician is so key, which is why the consultation, not only do you get that information about what goes into the surgery, what the healing is going to be like, but also just, does this seem, just sixth sense, intuitively speaking, a good match? Right.
Right.
Yeah.
And I also have to say that was the very first time that I'd ever come to your office and met your staff.
Yep.
And the general feeling that I got when I walked in was that everybody's happy here. Everybody enjoys working here, and that speaks to leadership.
Oh, yeah,
So that just kind of adds to the confidence level coming from a potential patient.
Definitely. Yep. And then obviously, you know this, but some of our audience may not know this. We are fortunate enough that we have all of our surgery centers built into our office. So that allows us to hand select our anesthesiologists, right? Our board certified anesthesiologists, our nursing staff. And so we'll go there next. Day of surgery. Did you feel like the staff was calming? What was it like kind of with your nerves going right into the procedure?
I was not nervous at all.
Awesome.
I was very excited.
Yeah.
I had my pre-op appointment, I believe, with Mo,
Yes.
maybe
Or
the week before.
yeah.
One of your nurses.
Okay. Yep.
And it was a very comprehensive appointment. There was a lot of material, but I felt very prepared.
Yeah.
I felt like I knew exactly what was going to happen. I knew what it was going to be like when I got home. I knew what it was going to be like 3 days after surgery. She did a really, really good job in preparing me for what to
Great.
expect. And the night before, I spoke with the anesthesiologist.
Yep.
And she answered some other questions. I actually had her talk to my husband as well,
Yep.
because just in case I was going to miss anything. But
Who's yeah, physician.
he
Yeah.
is a physician.
Yep.
I came in the morning just super confident and just very excited.
Yeah.
I
Yep.
was not nervous at all.
Yeah.
Really.
Yep.
I guess I should have been.
And I mean, I have to say this, Nikki is in so many ways that ideal patient. She eats really well. She came into the office already looking 10 years younger than her age. I mean, let's be honest. She didn't think so, but I think we all thought so. And now hopefully maybe 20 years younger than
Well.
that age, right? We knew that she was going to comply with all of the instructions and follow them to the T.
100%.
Just lives a very clean, healthy lifestyle. I knew that about her going into it. Did all of the things right after surgery, which I think is so underestimated and so important to optimize the healing. So that also made me feel very confident, because there's only so much we can do as surgeons and do all the things right. But then if there's not that kind of compliance on the back end, then maybe we don't have an optimal outcome, right? Maybe a great outcome, but not optimal outcome. So so that made me feel confident, of course, with Nikki. So surgery happens. What would you say the toughest part of that acute, healing, or maybe I think you have a story for us. Tell us about the first day. Let's start there.
Well, I have a very, very vague recollection of my husband being there, and I think I told him that it would be best if he drove.
Probably a good idea.
Yeah, I think that you should drive.
Yeah.
I don't remember going home. I don't remember getting in my bed. I do remember waking up after a few hours and being really, really uncomfortable. I have to say, I was super uncomfortable. I was not in any pain at all.
Yeah.
But I had this giant, massive compression bandage around my head. And of course, I had drains.
Right.
And it was just squeezing me. And I have incisions behind my ears, so it was really uncomfortable, but it wasn't painful.
Yep.
The funny story was that for some ridiculous reason, my husband let me have my phone near me, and I took a video. I did. I took a video of myself with this ridiculous bandage on, and I was talking about it like I was going to do my own YouTube video and share my journey with people.
It could have gone viral.
It would have gone viral.
Yeah.
I mean, it's pretty ridiculous, but I ended up sending it to you and to Luciana, and it's just very funny.
Yeah. And there was no judgment there, because we knew she was coming out of the anesthesia.
Yeah.
Yep.
And then I was, like I said, pretty uncomfortable. It was about 7 p.m. and I knew that the bandage was going to stay on until early the next morning.
Yeah.
I tried to go to sleep, but it was more watching the clock.
Yep.
Okay, 9 more hours. Okay, 7 more hours. Okay,
Yeah.
5 more hours. Okay, 2 more hours. I can do this. And then finally,
Yeah.
you took the bandage off, the drains came out, and I felt human again.
Exactly.
And I did not have any pain at all.
That's great.
None.
Yeah.
It was very uncomfortable that first 24 hours with the big bandage, but as soon as that came off, it was, okay,
Yeah.
this is doable.
Yep.
I'm good. And now we can start the work.
Yeah.
Because it actually is a lot of work.
Exactly. Yeah. And again, testimony to how well Nikki performed with her postoperative care, following all the instructions, doing everything to the T. I think that's really important because those first couple weeks, especially, it really is work. It's a full-time job.
It's a
And if you're
full-time
not
job.
treating it like full-time job, then you're probably not doing it right.
Right.
Yeah. Okay. So now I have a unique question for you. As you can tell, Nikki is obviously very fit, stays in excellent shape, has a lot of hobbies, and is always active. What was that like, not being able to exercise at full capacity for a few weeks?
That was tough
Yeah.
because when you're a person that it's part of your life, it's your lifestyle, it's what you do.
Yeah.
That part of it was very difficult. It was difficult for me mentally
Yep.
and emotionally. And then very, very slowly, once I got the okay to go back and start doing the Pilates again,
Yeah.
I had zero energy. It was just
Yeah.
zapped. I think it
Yeah.
was so many hours under anesthesia
Yeah.
that just really. So that took a little bit to come back.
Yep.
But I did. I was very determined to get my life back.
Yeah.
And so as soon as I had the okay,
Yep.
I started doing as much as I could.
Yeah.
The horses took a little while longer because I did have stitches and I was very concerned about keeping everything clean. So
Yeah.
I was having other people take care of the horses and
Yep.
and all of that. But I really worked hard to get my life back as quickly as
Right.
possible.
Yeah. Yep. And it obviously shows. So yeah, I think it's almost like kind of like physical rehab, to some degree, where you're not doing anything for a few weeks, and then you realize in anesthesia and surgery, for every upper there's a downer, and you get tired more easily, and even just going back to work, if you go back to work that second week, you don't have the endurance you're
Right.
used to.
Yeah.
Yeah.
There was just a
Yeah.
lack of endurance but I knew it was temporary.
Yep.
So it was just a matter of building it all back up and getting back to normal.
Yeah. Final question. Any tips, advice you would give to someone else that is about to undergo this journey?
Enlist your hairstylist. when when I came for my consult, your nurse told me to use Dawn dishwashing detergent to get the Aquaphor out of my hair, and I thought, okay, I pay way too much money for my color to do that.
Yeah.
So I was going to my salon
Yeah.
to get my hair washed,
Yep.
and I did that for the first 2 weeks,
That is
and I was
great
doing
advice.
that probably every third or fourth day. It was a great way for me to feel human again. And it was a lot of work to get. It's a lot of Aquaphor. I mean, you're putting this stuff on the incisions 3 times a day.
Yeah.
There's a lot of buildup.
Yep.
It was hours soaking in one of those shampooing bowls. But I
Yeah.
think that would be my number one recommendation.
Yeah.
Would be to plan this out.
Yep.
Plan it out with your hairstylist.
Yeah, that is great advice. And certainly one of the most common questions that we get is, when can I shower? When can I wash my hair? I just want to feel human again. And I think we
Exactly.
underestimate just normal daily, routines, and
Right.
just how good a shower makes someone feel and clean. And so that is great advice. So yeah. Well, thanks for being here today, being candid with
course,
your testimonial.
absolutely.
Again, this is another episode of Your Face Unfiltered. If you liked what you heard today, please be sure to like the video and subscribe to our page. And that's it for today.